Hello, we are Prescribable Apps, and we are developing a platform for patient self awareness in psychiatric care. Annually, a quarter of the United States population is living with a clinically diagnosable psychiatric illness. This leads to $115 billion in direct medical expenses, $190 billion in lost productivity, and an additional unquantified billions of dollars related to overutilization of the healthcare system. Adherence to treatment is the only thing that has consistently been shown to drastically reduce these costs. However, 3 months after an initial diagnosis, only 60% of newly diagnosed patients are adherent. By 6 months, this number has dropped to 43%, and during that initial acute phase, only 20% of patients are seeing their doctors on a monthly basis as recommended. Why is there such poor adherence? Patients often forget to take their medications. They don't fully understand the benefits of the medication. Side effects are severe, or the stigma and feeling of seclusion by being diagnosed with one of these conditions will lead to denial.
So how will our product help solve these issues? Our three main features include mobile check-ins consisting of three standard questions based on diagnosis, plus a flexible platform allowing the doctor or patient to add additional questions if desired. At set intervals, a standard diagnostic questionnaire such as a PHQ-9 will be administered to monitor patient response to treatment over time. There will also be reminders for medication adherence, prescription refills, and doctor appointments. So how will we generate revenue? Our three main revenue streams include subscriptions paid for by employee assistance programs or payers such as insurers or managed care organizations, clinical trial recruitment, and phase 4 trial information sold to pharmaceutical companies.
Our long-term vision is to use the data collected to provide actionable insights into treatment response and recommendations for medications that will lead to better outcomes. We also hope to develop predictive algorithms for proactive instead of reactive care, and we plan to branch out into the primary care setting, which is where 40% of psychiatric prescriptions are written, to use this as a launchpad to other chronic illnesses. My name is John Moore, and I am the CEO of Prescribable Apps. I started this company after watching friends and family living with their own psychiatric diagnoses struggle for years to identify the right treatment regimen. In the past few years, it became clear that mobile phone ubiquity could help my loved ones through disease tracking and better clinical decision making, which prompted the formation of this company.
I'm Chris McDonald. I'm also a founder of Prescribable Apps, and I come from the financial world but have been an entrepreneur at heart all along, learning web application development on my own time and sharpening the skills I'm using to get the Prescribable Apps product off the ground. After having similar experiences with friends and family, I'm really excited to be in a position to use technology to positively affect the lives of so many people.